Rabies is a zoonotic, viral disease caused by viruses belonging to the genus Lysovirus, under the family Rhabdoviridae. Etiology: the rabies virus is a bullet-shaped, single-stranded RNA virus that infects the central nervous system of mammals. It is transmitted primarily through the bite or scratch of an infected animal, with dogs being the major reservoir in Africa and Asia. Once introduced, the virus replicates in muscle cells at the site of the bite before migrating via peripheral nerves to the brain, causing acute encephalitis. Pathogenesis: the virus travels along retrograde exoplasmic flow to the spinal cord and brain. Once in the CNS, it causes neuronal dysfunction, inflammation, and eventually death due to respiratory arrest. Clinical signs: rabies has two major forms, furious rabies and dumb paralytic rabies. In furious rabies, the patient becomes hyperactive, aggressive, and hypersensitive to light and sound. In dumb rabies, the patient becomes weak, paralyzed, and eventually slips into a coma. Common early symptoms in humans include fever, headache, anxiety, and pain at the site of the bite. As the virus progresses, patients develop hydrophobia, aerophobia, hallucinations, muscle spasms, convulsions, and ultimately, coma and death. Lesions: at necropsy, rabies-infected animals may show negri bodies in the hippocampus, brainstem inflammation, and congestion of brain vessels. These changes are nonspecific, so laboratory confirmation is essential. Diagnosis: confirmatory diagnosis is done using direct fluorescent antibody test DFAT, PCR, and mouse inoculation test on brain samples. In humans, diagnosis often relies on clinical signs and patient history, since most cases are fatal before lab confirmation. Treatment: once clinical signs appear, rabies is almost always fatal. There is no known cure. Post-exposure prophylaxis PEP with rabies vaccine and rabies immunoglobulin is the only effective treatment if given before symptoms start. The PEP protocol includes immediate wound cleaning, followed by a series of vaccine shots and, in high-risk cases, rabies immunoglobulin administration. Prevention: vaccination of domestic animals such as dogs, cats, and livestock is key to breaking the transmission cycle. Routine human vaccination is recommended for veterinarians, wildlife handlers, and people working in rabies-endemic areas. Public health importance: rabies kills over 59,000 people every year, mostly in low-income rural communities with poor access to vaccines. The majority of victims are children under 15 years. Rabies poses a significant health challenge, requiring collaboration between veterinary, medical, and environmental professionals. Conclusion: rabies is 100% preventable, but once symptoms show, it is 100% fatal. Early action saves lives. Vaccinate your pets, educate your community, and never ignore a dog bite. Rabies kills, but together, we can stop it.